Hello guys, welcome to my YouTube channel. In this video I am going to tell you something about the diagnosis and test of diabetes. So basically, how is diabetes diagnosed? Healthcare providers diagnose diabetes by checking your glucose level in a blood test. Three tests can measure your blood glucose level. Fasting blood glucose test. For this test you don't eat or drink anything except water for at least 8 hours before the test, as food can greatly affect blood sugar. This test allows your provider to see your baseline blood sugar. Random blood glucose test. Random means that you can get this test at any time, regardless of if you have fasted. The next one is A1C. This test, also called HbA1c or glycated hemoglobin test, provides your average blood glucose level over the past 2 to 3 months. To screen for and diagnose gestational diabetes, providers order an oral glucose tolerance test. The following test results typically indicate if you don't have diabetes, have prediabetes, or have diabetes. These values may vary slightly. In addition, healthcare providers rely on more than one test to diagnose diabetes. So there are three types of test: fasting blood glucose test, random blood glucose test, and A1C. The normal range of fasting blood glucose test is 100, less than 100. And if a patient have 100 to 125 mg per deciliter, then it may be considered as pre-diabetic one. And if he have 126 mg per deciliter or higher, then he has entered the diabetic zone. For the second type of test, which is random blood glucose test, the normal range is nil. Pre-diabetic range is also nil. And if a patient has 200 or higher with classic symptoms of hyperglycemia or hyperglycemic crisis, he has entered the diabetic zone. The next test, which is called A1C test, has normal range less than 5.7%, and from 5.7% to 6.4% the patient is pre-diabetic, and if the range is 6.5% or higher, then the patient has entered the diabetic zone. Now we will move towards some management and treatment. So basically, how is diabetes managed? Diabetes is a complex condition, so its management involves several strategies. In addition, diabetes affects everyone differently, so management plans are highly individualized. The four main aspects of managing diabetes include blood sugar monitoring, oral diabetes medications, insulin, diet, exercise, etc. So let's start with the first one, which is blood sugar monitoring. Monitoring your blood sugar is key to determining how well your current treatment plan is working. It gives you information on how to manage your diabetes on a daily and sometimes even hour-based. So you can monitor your levels with frequent checks with a glucose meter and finger stick, or with a continuous glucose monitor called CGM. You and your healthcare provider will determine the best blood sugar range for you. So this is all about for today's video. In the next video we are going to discuss other remaining aspects. Thank you.